Dr. Beccy Cooper.
Yeah, thank you, Chair. And I'm going to continue actually a little bit with this line of questioning. So, as the Chair said, you all do things slightly different, and obviously you're competitors, but you all have made the commitment today that, improving people's access to affordable, healthy food is the goal of your supermarkets. So the various health initiatives that you have done, on the basis of the data that you have collected, what evidence do you have that particular initiatives have worked and what haven't? So perhaps if we go down the line quickly and you can tell us, based on data, evidence only, what works, what doesn't.
Want me to go first?
Go, yeah, absolutely.
So at Sainsbury's we have some of the most extensive test and learns that we have published externally, so nearly 12 since 2017. Let me give you two examples of things that worked, two where things didn't quite happen as we would have expected. What has worked is a promotion we did on fruit and veg, so pricing, reducing the price of 11 fruit and veg to 60p. I think we ran it in 2022. We saw a 78% uplift in fruit and veg sales during the promotional period on at least 9 of those 11 that were in there.
And have you continued that, or did you just have it as a promotion and then it went back afterwards?
So we continue to include a lot of fruit and veg in our Aldi Price Match campaign, and you may have seen that just yesterday we launched our half-price Nectar stunt, which features quite a number of fruit and veg. So
if you've got a Nectar card, then you can get the reductions in healthy food. If you don't have a Nectar card, it's more problematic.
Even if you didn't, which actually the vast majority of customers now do, but if you didn't, the Aldi Price Match applies to a high number of fruit and vegetables and is included in convenience stores too.
So there's price elasticity, that works, go.
The second is our fruit and veg challenge, which we've done through Nectar, where we incentivise and we use gamification to reward customers. They're personalised to them for adding more fruit and veg to the basket. We've seen that that has led to 780,000 customers joining that scheme and 113 million extra fruit and veg being purchased.
Gamification, basically rewarding people for making healthy choices.
Yes,
okay.
Exactly.
And if you just give me one example of something that didn't work.
Yeah, sure, no problem. Pricing also didn't work when we included fibre-rich products into the Aldi Price Match scheme. We included whole wheat pasta and brown rice in there. We expected to see customers more tempted to try them. Unfortunately, what we saw was existing high-fibre customers switched into the lines that were in Aldi Price Match, but we didn't see more customers willing to try those products.
And do you have any insight as to why that might be the case?
I think price alone may not be the barrier to trying those products. I don't have the answers, but I suspect it's more than just price.
Something around food preparation, perhaps?
Perhaps, yes.
Fine. Okay, thank you. That's really interesting. Is there anything else to add from your end?
So from an Aldi perspective, obviously data is limited from a customer insight specific point of view. That said, we are very, very clear that our customers want to keep it simple for them, and this is why we have moved fruit and veg to the front.
And when you say simple, you mean they want to come into the supermarket and it's very clear what's on offer and they can pick it up?
They'd like us to make the healthy choices for them as easy as possible.
Fine.
Which is why we have fruit and veg at the front of the store, and we know that Super 6 is a big driver of footfall for us into our stores. And so we know that customers want to have access to healthy food at a good price. Other initiatives that we know have been received really, really well is, whilst we're obviously having that access to healthy, affordable food in store, from a wider perspective, we've also got our Get Set to Eat Fresh programme. Okay. So this is through our sponsorship of the British Olympic Foundation, and it's managed to reach over 3 million children.
That's great advertising for you as well. Anything that hasn't worked particularly well?
What we haven't seen work well, and why we haven't introduced it for us at Aldi, is a loyalty app. And we don't see how that's adding confusion or to our customers that they don't want. We don't offer promotions in store, buy one get one frees, for example. It is simple pricing. You walk into the store, there's a level of equality when you walk into the store. That as you walk in, you know that you've got the same price to everybody else that's in there, and it will be at the lowest possible price for you.
Thank you. Beth, very quickly, anything that has worked or hasn't worked in your area?
We think this is a really important question. Customer behaviour is complicated and we see various behaviours across different categories. And I think for us, the ask is for policy to be outcomes based and allow us to prescribe the routes to deliver that change. Certainly, we're in a really similar position to others in that we have trialled initiatives over previous years, and we've collaborated with the IGD, with Nesta, Leeds University, etc. to
so anything that has worked worked or anything that hasn't worked?
Yes, independently analyse those results, and we try to publish those results so that they're available for learning and for others to kind of access the learnings of what we've done. In terms of what hasn't worked and what has worked, it's a really good question in that, you know, we have trialled similar initiatives in different categories or in different ways, and we see different results. And this is where, again, as you know, the custodian of our customer and understanding their behaviour, we feel
amazing, Beth. What has worked and what hasn't worked? I hear you.
Fair. So in terms of results of trials, if we've talked to merchandising, so the way that we position products in our stores, we did a trial with the IGD, for example, on meat free, and we were looking at driving healthy and sustainable choices across meat. And what we saw in the academia was that if we move products in a certain way, we could achieve behaviour change. When we actually did that in store, we saw a significant reduction in the sales that we were trying to drive. So I think, again, it talks to that customer behaviour being very specific to the category and the way that they shop our stores. Signposting is another example where, you know, the same intervention on messaging health within one category, we've seen very different results. So,
Beth, is it fair to say, I mean, obviously you have a lot of data and you've just sort of given us a very impressive sort of way of working with academia. Is it fair to say that you would acknowledge that the way your supermarket's set up would very much influence how your customers shop and their health choices or otherwise?
We think there are lots of levers that we can pull to drive.
And the setup of the supermarket, you would say, is what, I mean, there is evidence that is true. Would you agree with that?
I would agree with the levers that we can pull as a business to drive behaviour change. What I would say is if we look at HFSS legislation, for example, really complex, really costly for us to implement. When we have worked together across retail to analyse that independently through Leeds University, there's very minimal reduction in sales.
So I think we're going to come to HFS later.
Yes,
thank you. Una, anything to add?
Yeah, we're really clear. I mentioned at the beginning the barriers that our customers face when it comes to healthy food. So our focus is absolutely introducing initiatives and continuing to initiatives that address each of those barriers. So if I can give you an example for affordability, accessibility and inspiration. So from an affordability perspective, we all know cost of living is the most important thing. So our focus absolutely as a business is to ensure that for price, we are absolutely competitive on healthy lines. And a good example of that is our Aldi price match scheme, where we commit day in, day out to have all of those lines, 2/3 of those lines of 650 lines as healthy. That has been really successful for us. Okay. In addition to that, top card pricing, again, a really important mechanic. From an accessibility point of view, reformulation, others have talked about, is a really important lever. If I could use an example, which I know has been mentioned by others on this committee before, the children's yogurts category. Over the last year, we've worked really hard to take sugar out of that really important category for young people, and so much so that we've removed 16 tonnes of sugar from that category. We're now a market leader, and we will continue to move forward on reformulation. And then the final area, inspiration. As you can imagine, we continually are looking to see how we can inspire customers through all of our customer channels. So that's Tesco Magazine, which is the biggest consumer magazine, through our app, through what we do in stores, as you mentioned. And a recent example there would be our 5 a day campaign, which we launched last August. We are very aware, as many of you will be, that not enough people at all get access to their 5 a day across the UK, and indeed only 1 in 10 children. What we wanted to do was change that, and we still do. So we launched an always on campaign through all of our comms channels, and that has been really successful. At the end of that campaign, the first run in August, 42% of the basket focused on fruit and vegetables.
So sorry, we're running short on time, and I would just like to say for the record that 5 a day is the minimum, and we really should be aiming for a lot more than that, but thank you so much. So just as very quickly, it's really interesting to hear, obviously you're doing lots of different health initiatives. Obviously they're very good marketing initiatives as well, let's not be naive about that. But we do want to obviously sort of marry those two things together. So in terms of government support, as the chair pointed out, you're all doing slightly different things. You're all competitors. Regulation to basically level the playing field, whereby you're competitors in other things, but you're not competitors in sort of the healthy food area, whereby you've all got to hit certain standards. So you're all starting from the same place. Would you be supportive of that? Just yes or no? So if we start with Una.
Well, we're really
just yes or no.
I think it's really complicated actually, because we are a really big supporter of evidence-based regulation and policy.
Okay, so it's yes if it's evidence-based, basically.
And if it's developed with implementation in mind. So
okay, so it's a provisional yes. Beth, yes or no?
Supportive of evidence-based measures, supportive of mandatory reporting,
Okay.
but I think HFSS has shown us that evidence needs to be well-based. We're able to implement it.
Absolutely. I'm all for evidence-based regulation. I'm just saying regulation across all of you would essentially level the playing field. Liz?
Yes, supportive and mandatory reporting. We'd want to build on existing data so that we don't invest time in bureaucracy where we can be investing that in areas where we know we can win.
Excellent. Nilani?
Supportive of mandatory reporting, supportive of better enforcement of existing regulation, and supportive of regulation that does affect the whole of the system, so levels the playing field.
Great. Excellent. Level the playing field. So that's
We're going to come back to all of these points.